Hello, this is Dr. David Green, CEO of the California Pain Network. The topic today is an overview of medial branch blocks. Back and neck pain affect 90% of Americans at some point in time. Back pain is the second most common reason that people see a doctor, just behind the common cold. It's the leading cause of disability in those under the age of 45. Up to 40% of those who undergo back surgery are unsuccessful, and the cost of back and neck pain exceeds $100 billion every year. The facet joints of the back and neck look like this. They're thumbnail-sized joints on the left and right side at every level of the lumbar and the cervical spine. The intervertebral disc is the source of back pain about 40% of the time. So the disc is the shock absorber area here, here, here. And the facet joints are involved the other 45% of the time. And then 15% of the time, it's hard to say, but sometimes it's the SI joints, actually down here. Okay? So facet joints have cartilage just like every other joint, the hip, the knee. They can be small, they're only about the size of the thumbnail, but they can cause really bad neck or back pain when they're arthritic. Diagnosing of the source of the pain is very difficult in the neck or the back. A doctor will get a history and a physical, and imaging studies such as x-rays can be helpful, but this is one thing that's really helpful. Like, look at this CAT scan. You can see the facet joints on this side and the other side. They look pristine, right? No arthritis. Here, they're overgrown, they're enlarged, they have bone spurs. So you have an inkling that this is what's going on with this person. It's not definitive, though. So the medial branches provide sensation to the facet joints. So you have a nerve root coming out here, and then off of that nerve root comes these medial branches. Okay, branch, branch, branch. All right, so if you look at this joint here, you have some branches coming down from the above medial branches, and then some coming up. These are not motor nerve endings, they're just sensory. They just provide sensation. So when you have arthritis in this joint, these are the sensory nerve endings that cause that pain to travel to the brain. So a medial branch block is designed to block that sensation. There's two reasons it's performed. One is diagnostic. If it works, you can say, aha, that's the joint that was causing the pain. And it's also therapeutic. Image guidance is used, so a pain doctor knows that the needle is going into the right area. What's applied is always numbing medicine, but sometimes steroid is used, sometimes it's not. It's an outpatient procedure. It takes about 20 minutes. You really don't need sedation either. You can just give numbing medicine through the skin down to this area. So the diagnosis part helps pain doctors figure out if the joint is the source of a person's pain. If the injections work well and then wear off, you can either repeat the injection or perform a radio frequency ablation. And that's when you put a needle in the same area, but you actually burn these nerve endings and you deaden them, and that can provide pain relief for 6 to 18 months. It's been revolutionary for long-term pain relief. So for medial branch blocks, studies show that the average pain relief is over 3 months. Procedure works well in 85% of patients, and if it wears off, you can go on to the radiofrequency ablation or just simply repeat the procedure. And then if you do go into a radiofrequency ablation, as mentioned, you put the catheter in the same area, you deaden these nerve endings, and that gives consistent pain relief for 6 to actually 24 months. Those nerve endings can potentially grow back, and then you can just do it again, or in the back or the neck. The top California pain clinics are in the California Pain Network. There are multiple clinics throughout the state, from San Diego all the way up to San Francisco. They accept over 50 insurances, provide over 25 treatments, and the overall success rates are 90% plus. Visit us on the web at californiapainnetwork.com, and then call us at 877-877-8556. I'm Dr. David Green with the California Pain Network. Your pain stops here.